Everyone talks about which dental specialties make the most money. I recently made a few videos where I talked about dental specialties that make the most and the least money. And I also ranked the dental specialties based on how easy or how hard they are to get into. But no one talks about which dental specialties will absolutely burn you out. See, dentistry is already a stressful profession in itself. And a lot of people think specializing will release them from that. So today we're ranking the most stressful dental specialties in the United States based on real US data, as well as a little bit of opinion. We're gonna be taking a look at burnout rates, residency intensity, work-life balance, all the things. And yeah, number one is probably the one that you're thinking of. What's going on, everybody? My name is Dr. Eli, and welcome back to my YouTube channel. On this channel, I make videos with advice for pre-dental students, as well as vlog my dental school and residency journey. So if that's something you're interested in, please make sure you like, comment, subscribe, share, all the things. It really helps boost the channel in the YouTube algorithm and helps get the channel out to other people who need it. Now, according to the ADEA, dentistry already has some of the highest stress and burnout rates in healthcare. A lot of people go into dentistry because they hear it's a great work-life balance, it's a low-stress job compared to being a surgeon or other things. But a lot of people don't really think about what comes with being a dentist. I hear this from a lot of my classmates that went straight out into work, but one of the toughest things to deal with as a dentist is people coming in with a preconceived notion of you. Why is it that people are so comfortable sitting down in a chair and the first thing they say to a person they don't know at all is, "I hate the dentist"? I never did anything to you. But people have past experiences with dentists that are negative. They have dental anxiety from when they're a child. They think dentists are trying to upsell them or sell them on treatment that they don't really need. They may have a fear of needles. There may be a plethora of things that they don't like about going to the dentist. And as a dentist, you just have to receive all of that and move on. Like, you're not a human with real feelings too. Sometimes people come to the dentist and they emotionally dump on you, and you are an empath, but you have to do your job still just as well as if you've never heard that information. It can be a lot. You turn into some of these people's therapists accidentally, and you just kind of have to deal with it. And frequently, people think that specializing is your way out of this. You can just go in, do your work, be that specialist, and leave. You don't have to develop a relationship with some of the patients because you're not seeing them continuously, things like that. But that's really not true. And I'll be honest, the stress is not equal across all the specialties, that's for sure. So today I'm gonna be ranking some of the specialties and levels from low stress to high stress. And I'm gonna be talking about things like how intensive the residency training is, the typical work-life balance, call schedules, hospital exposure, patient complexity, and all the things. So starting off as number 5 on the list, and I'm gonna go from 5 being the least stressful and 1 being the most, I'm gonna have to put orthodontics at number 5. In the United States, orthodontics ranks as one of the most lifestyle-friendly specialties. The residency is often 2 to 3 years, which is not very long for the amount of return you get on that investment. A lot of the times you don't have to take a busy call. You do have to take call in residency, but usually it's not true emergencies. Your patients are mostly healthy and easy to deal with for the most part, and your workflow is very predictable and tight and really sticks to a good schedule. In the real world, the stress still comes. There's high expectations of you, especially cosmetic expectations. You have to run a business, manage a staff, but the pressure that you endure is very controlled. You know what's expected of you, and it doesn't come out of the woodworks. At number 4, we'll put pediatric dentistry. And I know that sounds crazy because if you've ever dealt with kids, especially in a dental setting, there is nothing low stress about it. But pediatric dentistry depends heavily on personality. In residency, pediatric dentists are trained to deal with the most difficult children. And over time, they develop tactics that they know works for them and helps them deal with these kids so that when they're in the real world, the general dentist that doesn't want to see them or can't handle them sends them to you and you'll do just fine. Pediatric residencies are 2 years. They do deal with hospital calls and things like that, and very high patient volume clinics. The behavioral challenges and the patient load definitely make pediatric dentistry a more stressful specialty to deal with. But as you grow in your skills, you gain discernment on which children need to be dealt with in a hospital setting and need nitrous and need full sedation and things like that. it becomes a little bit easier. So pediatric dentistry is really less technically intense, but mentally it can definitely be exhausting dealing with children like that all day. And number 3, we have prosthodontics. This is where the stress really starts to spike. You typically have a longer residency, which is 3 years, and especially in residency, you deal with complex cases like full mouth rehab while still having to deal with a high flow of lab work and a high workload in clinic. ADEA data shows that prosthodontic residents often report long hours and high academic pressure. Being a prosthodontist takes extreme attention to detail, dealing with high expectations for patient function and aesthetic, and long treatment times. That's definitely something that factors into prosthodontics that you have to deal with. So prosthodontics definitely sits up there with one of the more stressful specialties because there is a lot expected of you, almost more than orthodontics when it comes to cosmetic demands. Quick intermission to the video. If you're watching the video and you've made this far and you're enjoying the content, please drop a like on the video. It's right here under the video. Just click the little thumbs up button. It's of no cost to you and it does so much to help boost the video and the channel in the YouTube algorithm. Thank you so much and I hope you enjoy the rest of the video. At number 2, apparently is endodontics. This is one of the most overlooked high-stress specialties in the US. According to the AAE, the American Association of Endodontics, endodontists deal with high rates of emotional exhaustion, repetitive high-focus procedures, and the pressure to relieve pain almost immediately. After reading up on this, I'm starting to understand it because it seems like a lot of the pressure on endodontists and the stress related to their jobs come from the precision in their work, working under a microscope all the time, dealing with pain in almost every patient that they have to see, and the pressure of timing and getting a procedure done. Because don't get me wrong, I've done a few root canals in my life and they're not easy. Endodontists make them look like a cakewalk, but that's because of all the training that they've been through to deal with these different types of roots and teeth and morphology. But it's still a very high pressure job. Because imagine someone comes to your office and they're in severe pain and they've been told that this root canal is going to put you out of pain, but then it doesn't happen. Imagine how upset and how angry they are. And imagine you as the practitioner having to go in and redo a root canal or do something else to get a patient out of pain. And now you're not getting paid for it because you were supposed to fix it the first time. There is not much room for error when it comes to endodontics, and you're working on a level of millimeters in a place that you can't really see. If you ever looked at a tooth under a microscope and you're doing a root canal and you're in the root, you can see better than you can with loupes or with the naked eye, but at a certain point, you can only see your work through an x-ray. So yeah, it is pretty stressful now that I think about it, but I know a few endodontists and they surely love their job and seems like they live a very good life, so I don't know. And number 1, of course, oral maxillofacial surgery, you guessed it. They top the charts and it's not even close. Think about how stressful OMFS residency in itself is before you even get out into practice. You got super long hours, you got hospital calls, 24-hour shifts, still got classes and lectures that you have to attend, board exams, all this stuff. And to take it up even another notch, if you're doing a 6-year residency and you're doing 2 years of med school, oh, I couldn't even imagine. You get exposed to trauma, infections, emergency care, all the different things. You're still dealing with patients in pain like endo. You still have to deal with comorbidities of certain procedures. I'm beating a dead horse here when I say it's the most stressful. This is the surgical residency. You are the surgeon. So of course your stress levels are gonna rival those that are doing medical residencies and training for surgery. And when you get out into practice, you're all on your own now. There's no preceptor that's gonna come and save you or that you can ask to come do something for you. It's on you. So that training really, really matters, and the real world can be just as stressful. So on my final list, I got number 5, orthodontics, number 4, pediatrics, number 3, pros, number 2, endo, and number 1, OMFS. But here's the secret that nobody tells you. The most stressful specialty for you will be the one that doesn't even match your personality. So a lot of the time I hear people say, oh, I'm ranked top 5 in my class. Should I do ortho or endo or OMFS? I don't really know. And my question is, why don't you know? Do you think that you should just specialize in something because you have a high class rank? All of these different specialties are vastly different. And if it's not something that you actually enjoy, you're gonna be miserable. I don't think you should look at it as, well, I ranked high in my class and I should specialize because I'll make more money, because you'll actually be miserable if it's something that you don't like. Think about it. Specializing means that's it for you. You're not doing all the other stuff that you learned how to do in dental school anymore. So you shouldn't just chase income or prestige. You should do something you are truly passionate about, no matter what. Always, always, always pick what you can handle long term. That's all I got for today's video. I hope you guys enjoyed it, and I will see y'all in the next video. Peace.
I got baguettes in the back of my ring, and I went he trying to hit. I told her she gotta run to the team before she can talk to the list. Before she can talk to the dead. Lamb chop, I just pulled up in some fools. I told her mama tie all my shoes. Showed her 2 million cash, now she woozy. 20 watches and I'm still snoozing. I had came up out the trenches, then I had beat a few bodies like Boosie. She said you Merkle, I show you my Gucci. I had to sing to the stage like Latusi. Yeah, 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 yeah. Bitch got a backwood on her nightstand, she must be fucking with Gunna. I fuck with slacks and we gonna eat racks, and I came with some fucking piranhas.
Got a bitch Scotty, I got in my wellies, somebody brought me a treat. Came out the hood in my truck, got a hood knife, crack out the car with no keys. Beat it, she for the street needs, only one she got hit at the street need. I feel a little rich this week, to influence my family to not be cheap. I told her FN on me, Connie she needs just a Glocky key. We rollin' CC, locked in seats, we rollin' that coupe with a bucket seats. Got it up mud like a football cleat, I use a trap out of that photo geek. Call her the plug and he know what I need. I stay underneath so we hardly speak. Yeah, I'm in New York counting money. Yeah, ain't the same man but I'm stunning. Yeah, one of these guys wanna love me. Yeah, my wife didn't know love me dodgy. Yeah, 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 yeah. Let's go. Bitch had an X stain on her jeans. I know she fucking with others.
Yeah. I fuck with slacks and we gonna eat racks, and I came with some fucking piranhas. Yeah. I fuck with slacks and we gonna eat racks, and I came with some fucking piranhas.
Yeah, I'm in New York counting money. Yeah, ain't the same man but I'm stunning. Yeah, one of these guys wanna love me. Yeah, my wife didn't know love me dodgy. Yeah, I'm in New York counting money. Yeah, ain't the same man but I'm stunning. Yeah, one of these guys wanna love me. Yeah, my wife didn't know love me dodgy.